Hello everyone and welcome to Karnataka Muslims. Today we have the honor of interviewing Dr. Tameem Ahmed, who is a distinguished cardiologist known for performing highly complicated surgeries that are found to be challenging by the other institutions. He has a track record of performing over 7,000 surgeries and being successful. Recently, one of his surgeries that he performed on a South African woman gained attention. We are going to talk to him about the intricacies of performing these surgeries. There was a recent surgery that you performed on a South African woman, and it was a successful one, and it has gained a lot of attention now. So, what was this all about, and how was it unique from the other surgeries, and how challenging was it for you?
See, all heart surgeries are something special. Heart is life. It's from where everything begins. Treating any single patient of heart is always a challenge. This lady came from very far, from Sierra Leone, which is in West Africa, and was suffering from a very major disease called aortic dissection. The aorta has becoming big. 2-3 centimeter is becoming like a balloon. Has gone to 15 centimeter and is anytime ready to rupture. Thud. So it's like a bomb inside the chest. So this is a very dangerous situation. To take care of it is requiring a very high state of art of expertise of the team, of the people, of the system, of the support to organize this in a setup like a little far away from the major city. It's a huge challenge, and we have overcome a lot of challenges, including finances for the patient, which this operation costs huge amount of money in the Western Hemisphere. Even in the Indian subcontinent, it costs huge amount of money. We've been able to organize all that, and it was a long surgery. It's always lasted for 18 hours. The surgery is so that a lot of times many centers have to put the total circulation into stop. You have to cool the body to very low degree centigrades and stop all the circulation of the blood to the whole body, make it frozen, and then do the operation. This is the kind of operation. We didn't have to do it because we were quick enough and we had organized it enough to do the surgery. And we have done a special operation in which we have made a tube which is available with a cloth, replaced the aorta, repaired the aortic valve. A valve repair, again a rarity, replacing of that aorta and getting a success out of this kind of operation, it's a rarity. By God's grace, alhamdulillah, we have been able to do it.
So, the motto of the seminar today was inclusivity in healthcare. So, how do you perceive this concept, and how does it influence your approach towards healthcare?
See, I come across a lot of patients in my own family requiring heart treatment. A lot of big people in this country, when they're requiring heart treatment, is becoming difficult for them to get the right quality treatment in this country or maybe anywhere in the world, except for few places in Europe and America. In India, there's a challenge always to be able to provide high quality care for the normal person. If it's my father, my brother or my child, how I need to treat is how a VIP is getting treated. A common man without anybody, a common man without any resources should be treated that way. Shouldn't it be? Yes. What does it require for treatment? Care. What kind of care? Highest level of care. For highest level of care, what is required? Hospitals. The best of the doctors need to come to treat the poorest of the patient in the best possible way. For that, what support is required? Governmental support is required, organization support is required, institutional support is required. So it is a very big challenge to get all this together and be able to provide it for every common single man.
So, in your experience, how has technology evolved? How has healthcare evolved to give better outcomes for all these challenging situations?
See, healthcare will be evolving. You would have heard of artificial intelligence evolving. You can't replace a person's heart without having a heart. Dil hai na? You cannot make technology dil. Emotions you cannot make dil. Without the emotions, this kind of treatment doesn't happen.
So, as a cardiologist, what message do you have for individuals with these kind of problems? Any words of motivation that you have for them?
Now, see, I'm a heart surgeon. I run a heart team. Words of motivation. Life is short. I always tell a patient that I don't know if I am going to live for more than what you are going to live before I do the operation for the patient. I don't know if I'll come tomorrow. I don't know if you will live more with this heart problem or I will live more without the heart problem. Correct?
Yes.
Is that not motivating enough? Can't lose hope. Can't lose hope. We don't lose hope. We just I've seen a movie, Reverent. देखो तुम्हें Reverent. The will of surviving, if we infuse it into the patient and the attendants, we always will have lot of power from inside and make duas, make ask God, help my patient and do the best with the best intention and the best knowledge. First, you acquire skill, have the best knowledge, have the best skills, have the best intention, then everything will fall in place.
Thank you, sir. Thank you for speaking
you
with
so
us. We were speaking with Dr. Tameem Ahmed, who is a distinguished cardiologist. He was talking to us about the intricacies of performing heart surgeries, how one requires immense willpower and empathy towards the patient.